I was very, very positive about everything because my mom had breast cancer 35 years ago and she's still with us today. She's 86 years old. So I thought if she can beat it, I can too. My name is Maria. I'm 60 years old. In December of 2017, I was diagnosed with stage 4 lung and bone cancer.
We didn't expect it at all, so that was definitely blindsided us. I think my sister and I and my dad coming to us, she just had some back pain, so that was like the least thing on our mind that, we'd get this diagnosis of cancer. I am a nurse, an RN at the hospital, so for me, knowing certain things in the medical field, I think took it pretty hard, and trying to navigate what the best medication to take and best route to take was a little bit difficult.
The reason I chose Dr. Gerb is that a girlfriend of mine was diagnosed with ovarian cancer, and she was a patient here. So as soon as she found out that I was diagnosed with cancer, she gave my daughter a call and just asked if I was interested in seeing her naturopathic doctor. I was here within a couple of days after I was diagnosed.
I definitely checked Dr. Grimm out and see kind of what she does here, and we met her as a whole family, and she was extremely knowledgeable. Like, she wasn't just like a quick doctor's visit, you're in and you're out, here, take this medication, it'll make you better. And then with the family, she was just caring as well, which felt like she cared about us and cared what the outcome was going to be. She's honestly been our number one, through the whole process. She explains tests, she explains why she's giving her some vitamins and LRHT, all of that. So,
well, as soon as she told me that the LRHT would shrink the tumor, I thought, you know what, I'm going to try this. I'm going to do this. It was wonderful, nice, relaxing. I'm lying on a nice, warm water bed. A lot of times I would fall asleep. I was in there for 2 hours. And for the first couple of minutes I was awake, but then I would fall asleep for pretty well through the whole thing. It was nice and comfortable and relaxing. She is giving me some vitamins, intravenous vitamins. It's vitamin C, DCA, and ALA. All these vitamins are supposed to help with the cancer, and I believe they did. It's just I guess it was a bit of everything, and it seems like it has helped, because when I went for my test, the tumor is very, very small, and there's no sign of active disease there. So I believe in that.
Just hearing that there was no evidence of active disease was very shocking. So it took a few days to actually kind of understand and recognize that we're kind of looking up now. So hopefully it stays that way and gets even better, and she still stays healthy and she has energy. And if you look at her, you would never know that she even has it. I'm also coming twice a week at Innovative Fitness. It's for exercise, first of all, and also to get my bones stronger, which I find that it has helped. I've been coming here since January of 2018, and I feel like I'm getting much, much stronger from the first day that I came here. I have 2 trainers, very professional, and they're very educated, so I'm very pleased with it.
It's been a pretty cool transformation. She's, the last couple of months, has been able to work harder and harder. Her strength has gone up by quite a bit, and yeah, it's really cool to see how she's just so awesome and so upbeat and positive when she comes in here. When she first started out, we didn't push her too hard, just trying to kind of figure out and see what her capabilities were, making sure she's moving properly, and just trying to stay within Dr. Gurm's recommendations for kind of elevating her heart rate, and just try not to push her too hard so that she could kind of recover in between workouts and things.
I was a little scared a bit when she was like, I'm gonna go lift some weights. I'm like, don't break bones, don't do any of that, like, be very careful. But I felt really comfortable with Innovative Fitness just because it was Dr. Gurm's suggestion, and they know her situation, and they've kind of dealt with patients with cancer as well. So I was a little bit more comfortable with that than her just going to a regular gym just by herself.
it's really helping a lot. You know, I feel much better when I come out of there.
I found the first couple of appointments too, not just with Dr. Garm, but with other doctors. You know, all 4 of us were going to all the appointments in the first couple of months. With the treatment plan, it was good that we were all there because we heard stuff that she might not have heard, or she heard something that we didn't. So I found that was really great.
Dr. Garm is very easy to understand when she explains things. She doesn't really use the medical terms, which I wouldn't understand.
And the nurses were great. The atmosphere is awesome here as well. You don't just come and they don't just say hi. They know your name. They know the family's name. They know everything that's happening in your life. So I think personally, like for me, what I've seen is for her, it's almost a support group coming here as well. Because, you know, you have your family and they're all supportive, but it's kind of nice to talk to someone who's been going through a similar situation. None of our family members that are extremely close to us have had cancer. So coming here, I think for her, they have a Facebook group and all that they actually chat and they're supportive of each other, and she gets to talk with them, that stuff maybe she can't talk to us about.
You know, they're great people, the nurses are great, and Dr. Garm is fantastic. They're doing a very wonderful job because I'm doing well as of today.